Good morning and welcome to Healthcare Heroes, a celebration of the individuals in the healthcare industry who have been under tremendous pressure and strain as they took on the brunt of the COVID-19 pandemic. BizWest is excited to present this event, a revival of legacy programs in the Boulder Valley and Northern Colorado. I'm Chris Wood, editor and publisher of BizWest. Before we begin today, I want to acknowledge the sponsors who made this event possible. Our supporting sponsor, Anthem, Blue Cross Blue Shield. And with us to welcome you all this morning is Charles Ritz, President, Colorado Commercial Business. Charles, welcome.
Hey, good morning, Chris, and thank you. Guys, my name is Charles Ritz, and I'm the president of Anthem Blue Cross Blue Shield of Colorado. And I'm so happy to be with you today because if there was ever a time to recognize our healthcare heroes, I think we can all agree it's now. What an incredible 18-month journey we've been on as a community, and our healthcare heroes have been at the front line of this throughout the duration. Anthem Blue Cross Blue Shield has been in Colorado for more than 80 years, and today we're proud to serve the healthcare needs of more than 1 million Coloradans. Respond, recover, reimagine. That's been our mantra at Anthem over the last 18 months. We responded to the needs of our customers with special enrollment periods, waiving cost shares for COVID testing, and expanding telehealth. Then we had the responsibility to help our community recover. Through nearly $1 million in charitable giving, matched by our foundation, we supported food banks across the state of Colorado, matched our associates' contributions, and one of our associates even led a Feed the Front Lines effort supporting food for Front Range hospitals. And now we're helping our customers reimagine life after the pandemic with telemedicine, digital tools, and innovative high-value health plans at an affordable cost. Every organization in our community has had to adapt, and together we've made it. So while we recognize those who worked on the front lines despite the risks of their own health, let's all celebrate how far we've come. Congratulations to all the healthcare heroes that we'll celebrate and recognize today. And I'll leave you with a quick video about Anthem, who we are, and what we believe. Thank you for being here today.
Confidence. It gives people the courage to dream, to do, to succeed. Confidence helps people build families and businesses and all the possibilities that go with them. Anthem is driven by the belief that good health can help build confidence. It offers a sense of well-being and protection through physical, emotional, and financial health. With a unique combination of technology and empathy, we anticipate needs and create more efficient ways to connect consumers with the right solutions at the right time. Anthem is reimagining what is possible for every moment of health. Through our collaborative efforts in medical, pharmacy, specialty, and behavioral fields, we're helping to usher in a new era of health. It means being an advocate when an advocate is needed most, focusing on the total person, addressing each stage of their personal health journey. The confidence of care. It is about improving the lives of the people, businesses, and communities we serve. A world where people feel covered, protected, and confident. Because with confidence, anything is possible.
Thank you, Charles, and thank you to Anthem for your sponsorship of our Healthcare Heroes program. We also want to thank our associate sponsor, H2 Manufacturing, and our trophy sponsor, the Weld Trust. We also formed a healthcare coalition to help in many ways with this program, including helping craft our award categories, getting the word out to secure nominations, as well as help cover the costs of such an endeavor. So it is with great pleasure that I share those organizations with you. Columbine Health Systems, Boulder Community Health, Centura Health, Avista Adventist Hospital, Good Samaritan Society, and SCL Health, Good Samaritan Medical Center. Thank you to all of the members of the Healthcare Coalition. Social can be shared today at #HealthcareHeroes. We also had a lot of help from key individuals retired from the healthcare sector who performed the time-consuming and difficult task of selecting today's honorees from a robust number of more than 100 applications. We were very fortunate to have them on our side, and I would like to thank and honor them now. Dr. Joel Montbriand founded Gastroenterology of the Rockies, and Metamorph, an MSO providing back office technology and services for GI practices and ASCs. During his 32 years of practicing medicine in Boulder County, he used his clinical expertise and business acumen to dramatically expand the early detection and prevention of colorectal cancer, as well as improve the quality and availability of treatment of digestive disorders throughout Boulder County and the greater Denver metro area. George Hayes, former CEO of Medical Center of the Rockies and with more than 35 years of healthcare experience. Julie Johnson Hafner, with 45 years of experience in healthcare and community fundraising, institutional development, special events, and grant writing in Northern Colorado. Gene Hafner, former Director of Public and Community Relations for Banner Health North Colorado Medical Center. He also has had leadership roles with the University of Northern Colorado, the City of Greeley, Morell and Associates, and Colorado State University. Ron Seacrest, president of the Boulder Community Health Foundation from 2002 to 2015, and city manager of Boulder for 29 years. And finally, Charlie Harms, who spent 30 years as a hospital CEO, including time at McKee Medical Center in Loveland and Cheyenne Regional Medical Center in Cheyenne, Wyoming. We are very grateful for their time, energy, hard work, and ability to make some very tough decisions throughout this process. Now it's on to the awards. It is an exciting day, and I'm very pleased to celebrate some amazing individuals and organizations, each of whom will receive a Healthcare Heroes Trophy. Please visit the BizWest.com website to review the award categories and criteria. We have a lot of awards to get through, so let's get to it. Our first category is community service, and our three, you can see all of the nominees up on your screen. Our three finalists are H2 Manufacturing Solutions. Longmont-based H2 created a variety of programs to help the community deal with the pandemic, including repurposing the company's manufacturing equipment to produce PPE for domestic violence and homeless shelters. The company also produced reusable face respirators. Noelle Rodriguez, Loveland resident, launched an Adopt a Senior program to help high school students whose lives were disrupted by COVID-19, matching high school seniors with local residents and surprising the seniors with baskets with snacks, small gifts, and inspirational messages. And Sunrise Community Health, a nonprofit health center serving Northern Colorado from 12 clinic sites in Greeley, Evans, and Loveland. The organization's COVID response resulted in 124,000 primary care visits with 12,000 COVID tests, 16,000 dental visits, more than 40,000 vaccines administered at on-site and community COVID vaccine clinics, and with more than 29% of its vaccines provided to people of color. It also had 83,000 patients served with curbside grab-and-go pharmacy services and 610 patients served with curbside lab-and-go laboratory services. And our Healthcare Heroes honoree is Sunrise Community Health. And here with us is Mitzi Moran, CEO of Sunrise Community Health. Mitzi, good morning and congratulations.
Thank you very much. I want to congratulate all the nominees and the awardees that you're going to present today. We are humbled to be amongst this group. I want to thank BizWest for doing this, recognizing what life has been like and honoring healthcare heroes. It's touching. I'll take my quick moment to thank the Sunrise team here. They leaned in so hard during this storm. We are a port in the storm every day for our patients. We serve 42,000 people in Northern Colorado, many who struggle, the majority who struggle with living with low income. And we're a port for them every day in the storm. But when it's raging, it was really important that we be a port and stand steady. So we did. And not only just with COVID care, but the rest of our patients' needs, because hypertension and asthma and diabetes and babies being born didn't go away. So we had to maintain all our normal services while standing steady during COVID. So I wanna congratulate them for the work that they did. They did it with compassion and drive and dedication, and I'm just so proud of how they adjusted in the middle of this storm. And I want to encourage everyone, if you want to thank and honor your essential workers, your first and last responders, the best way you can do that is to get your vaccination. Help in this pandemic for all of us. Thank you.
Great. Thank you, Mitzi. And please convey our thanks and congratulations to the entire team at Sunrise. Our next category is COVID-19 frontline healthcare worker. And you can see the nominees on your screen. Some great nominees in this and every category. Our three finalists are Jennifer Hogestad with UCHealth. The nominator described Jen as an outstanding nurse who provides excellent care to all of those around her. She's compassionate, personal, and attentive to the needs of her patients and their families. She was described as a fantastic coworker, always helping in any way that she can. She brings a bright and bubbly attitude and comic relief to those around her, especially in such a tiring job. And not only is she a great nurse, the nominator said, but she also serves her community as a 911 paramedic in the city of Greeley. Rebecca Jackson with Columbine Health Systems. Dr. Rebecca Jackson is the medical director for Columbine, which had the first COVID positive case in Larimer County and the first positive nursing home case in Colorado. She selflessly dedicated herself to being a member of the system's Emergency Operations Committee, spending months working 10 to 14 hours per day, 7 days per week, developing COVID strategies and protocols. She worked with local, state, and federal authorities on a residential care strike force to pivot 5 nursing homes, 3 assisted living centers, 4 independent living centers, home care, medical equipment, pharmacy, infusion pharmacy, transportation, and medical equipment stores with 1,500 employees and more than 1,100 residents and clients to caring for COVID. Mo Lyons with Banner Health. Dr. Lyons is a cardiovascular thoracic surgeon. In the beginning stages of the pandemic, Dr. Lyons actually took shifts in the ICU, taking care of COVID patients. He actually contracted COVID, was quarantined, recovered, and came back to the hospital to work. He also donated his post-COVID blood to be used as therapies for COVID patients. And the Healthcare Heroes honoree is Jennifer Hogestad with UCHealth. And Jennifer is here with us today. And Jennifer, congratulations for this honor.
Well, thank you so very much. Out of all of those names and the other 2 nominees that were right next to me, I'm astounded that I was actually chosen for this. So that is fantastic. I truly love what I do, and I like to spread kindness and love to everybody I meet, whether it's at work or at home. And I think that that's truly felt through this nomination. So thank you very much for this opportunity.
Great, thank you, and congratulations again, Jennifer.
Thank you.
Our next category is COVID-19 frontline nurse. You can see our nominees on your screen. And our 3 finalists are Cheryl Baum with New Mercer Commons Assisted Living Facility and Columbine Health Systems. Cheryl is described by the nominator as one of the most hardworking and dedicated nurses they have met. She consistently goes to work with a positive attitude, no matter what the challenges of the day. She has adapted to change with COVID policies and requirements and has helped to educate and hold other staff accountable. She has been a resource and support system to other staff. Joel Bittler with Columbine Health Systems as Clinical Director of Columbine. Joel has gone above and beyond leading the organization since the beginning of the COVID-19 pandemic. He quickly established an emergency operations committee, and along with his team, he led the organization in interpreting and implementing the rapidly changing guidelines. He is instrumental in helping facilities to navigate outbreaks to best serve residents and staff by ensuring seamless collaboration among public health, facility leadership, and other resources. And Amy Pravopoulos, UCHealth Mountain Crest. Amy has been a nurse at UCHealth for nearly 7 years, with the vast majority of that time as a registered nurse dedicated to the behavioral health service line through Purdue Valley Health and now UCHealth. Amy is dedicated to providing a source of hope to each of her patients every day and focuses on that driving force in the care she provides to some of the community's most at-risk populations. And the Healthcare Heroes honoree is Joel Bittler with Columbine. Joel is with us today. Joel, congratulations.
Thank you. Thank you very much. As you mentioned, we were leading the front, had our first COVID case way back in early March of last year, and it's been a long year. And we couldn't have done it alone. You know, the emergency operating committee that we established, everybody took a very vital part. We divided and conquered and spent a lot of long days working hard. So I couldn't accept this award without thanking each and every one of them and making sure that they're recognized. Also, my family, my son Silas, my daughter Linnea, and my wife Emily were instrumental in keeping the world outside of Columbine afloat and allowing me to spend those long days there. So I really thank them as well. But really, you know, every single healthcare employee, worker, volunteer, everybody deserves an award. It was a year unprecedented from anything we've seen in the past. And I really, truly think everyone, especially all those nurses at Columbine, deserve a pat on the back. So thank you all. I appreciate it. And thanks BizWest for the award.
All right. Thank you, Joel. And next is our COVID-19 Healthcare Ally Award. You can see our finalists coming up on the screen, or our nominees rather. And our 3 finalists are AMR paramedics and EMTs. They were on the front lines, with some working in a local emergency room as well, placing them at risk at both places. They had to rush into homes when not just one individual was sick, but possibly more. Many of the workers ended up getting sick, but still continued to work hard after they were well to save an unknown number of individuals. And Foothills Unitarian Church participated in the NOCO Gets Vaccinated initiative that spread vaccine awareness, working with a collective of organizations to build trust in communities of color, specifically the Black and Latinx communities. This coalition of agencies proposed a community-based vaccination education and signups program, relying on established networks of trust via these agencies, coordinated community-based mobile sites, communication coordination via a campaign that is culturally attuned to establish trust in the vaccine by leaders of color in the community, and addressing the economic impact of vaccination, such as lost wages from missed work for vaccine appointments or side effects. And UCHealth Northern Colorado Foundation. The foundation and a committee of non-clinical UCHealth employees, with help from local businesses, organizations, and individuals from throughout the region, went out of their way to support healthcare workers with a variety of support, including establishment of the Healthcare Worker Emergency Relief Fund to support healthcare workers with short-term financial assistance. And the Healthcare Heroes honoree is Foothills Unitarian Church. And joining us today is Kelsey Diastra with Foothills Unitarian Church. Kelsey, welcome and congratulations.
Thank you. We are so grateful for this recognition, and we are especially appreciate being recognized as a whole church community, because perhaps ironically, during this time, we have felt an enormous sense of collaboration with more people helping and serving each other than ever before. Foothills actually counts over 300 leaders who gave of their time and care to support their neighbors during the pandemic. But over the past year, while we recognized that we were all experiencing the trauma of the pandemic, we did recognize that some people were being impacted more than others. We were not being all impacted equally. And so we drew on our long hint to justice to leverage our resources for greater equity. We worked with ISAC to receive and distribute over $500,000 in grants to support immigrants impacted by COVID. We adjusted our food bank to be a drive-through so we could better serve our Fort Collins community. And we established a new partnership and fiscal sponsorship with the emerging organization, the BIPOC Alliance. BIPOC Alliance was founded by community leaders, Johanna Ujoa and Andrew Naves, to address racial equity in Northern Colorado. All of this work culminated in early 2021 as vaccines began to become available. We saw in our church community how access was limited and how confusing it was to sign up. And we imagined that this would be even more true in communities that had more people of color, less access to healthcare, who were not retired, and whose first language was something other than English. So we reached out to our partners, the BIPOC Alliance, ISAC, and also Fuerza Latina, La Cocina, and the Family Center, to establish a new alliance with their leadership and expertise at the center. We secured initial funding for their profile of their role as leaders in public health. And we really hope that this alliance and its work in vaccine equity will have lasting effects for public health long past the pandemic. We are grateful to be able to serve our Northern Colorado community in the ways we have over this pandemic, as it represents so well our mission to unleash courageous love. And we want to acknowledge the work of the Salute Clinic, especially Foothills members Courtney Butner, Leah Schultz, and Doug Whitman for their partnerships and leaderships in health during this time. Thank you again for this recognition, and we look forward to continuing to work together in our community's ongoing recovery, committing ourselves to serving those who are most vulnerable, and to transforming systems towards greater equity and justice. Thank you so much.
Great, thank you, and congratulations again, Kelsey, to you and everyone at Foothills Unitarian Church. Our next category is COVID-19 support worker. You can see all of the nominees on your screen. And our three finalists are Gloria Gonzalez Engel with Boulder Community Health. Gloria has always gone above and beyond even before COVID-19 hit. However, when the pandemic began, the hospital's unit 3 North was changed practically overnight to become the unit strictly for COVID-19 patients. Gloria's nominator said that she always came in, and even though things had changed drastically as far as her task went, she did not let it bother her. She put a smile on her face and made her very sick patient feel as though they were not alone. And Jeremiah Martinez with Boulder Community Health's Sterile Processing Department. During the pandemic, the need for personal protective equipment became a necessity of survival for all, especially for frontline nurses, physicians, and aides. The personal face respirators, N95 masks, helped to protect frontline workers from COVID-19. As these masks became increasingly more difficult to attain, the FDA allowed the decontamination and reuse of the life-saving masks. Jeremiah worked 5 to 6 days a week, starting at 6 a.m. to round every department in the hospital to pick up and decontaminate masks, with some days seeing more than 300 masks being processed. And Marilyn Schaefer with UCHealth Greeley Hospital. Marilyn accepted a new position as the supervisor of respiratory therapy in March of 2020. Perfect timing. Greeley Hospital experienced an early and significant COVID-19 patient surge. She proactively saw the need to get specific filters for ventilating these patients and ordered enough to share with the region. She worked diligently with the respiratory therapists, physicians, and nurses to provide high-quality care and leadership to the respiratory team in her new role. And the Healthcare Heroes honoree is Gloria Gonzalez Engel with Boulder Community Health. And I do not believe that Gloria is with us here this morning, but we certainly congratulate her and will ensure that she receives her trophy. Our next category is Distinguished Service. And you will see the nominees on your screen. And our three finalists are Fred Pitzel with Good Samaritan Society, Fort Collins Village. Fred's sole objective as administrator for the past year has been to keep COVID-19 out of the Good Samaritan Society Fort Collins Village building. And although a few staff members contracted the virus along the way, it never spread, with not one of the residents infected the entire year. The nominator attributed this to Fred's leadership, focusing the entire team on that singular outcome. And SCL Health Good Samaritan Medical Center. The Good Samaritan Medical Center Hospital's Incident Command Team gave all they had and more to keep staff and patients safe and well cared for, from securing PPE for caregivers to keeping departments staffed, while also finding other duties for staff to minimize lost hours. The team worked to track community numbers and frequently changing guidelines, informing everyone, testing ill staff, and finding ways for patients to visit loved ones. And Lauren Shimp, Columbine West Health and Rehab Facility. The nominator described Lauren as extraordinary in the COVID-19 pandemic, as she truly carried her building during that time. Her stamina, attitude, leadership, compassion, decision-making, and hard work was absolutely extraordinary, the nominator said. Lauren made sure that each staff member had understanding as she communicated every effort being made and changed during that time. And the honoree is Lauren Shimp, and Lauren is with us here this morning. Lauren, welcome and congratulations.
Good morning. Thank you so much. I want to say that it's a huge honor to be accepting this award today. I want to specifically thank my team who stood beside me day in and day out throughout this entire journey. I also want to thank my family and my husband, specifically Tyler, who was there for me and created a safe space for me outside of work to grieve the bad days and celebrate the good days. And I also want to thank the folks who nominated me. Thank you very much. It means the world to me. I love my residents and I love what I do. And thanks for the opportunity to serve. And thank you for the opportunity to continue to serve the community. Thank you, BizWest, for the award.
Great, thank you, and congratulations again, Lauren. Our next category is Healthcare Innovator Researcher. You can see our nominees on your screen. And our three finalists are Banner Innovation Group. The Banner Innovation Group identified problems such as shortage of personal protective equipment and hand sanitizer. They then looked externally for solutions, building community partnerships with companies including distilleries to make hand sanitizer and an art production studio to 3D print face shields. Internally, they transformed a corporate office into a mask production factory. During the pandemic, the team made more than 1 million masks and filters, 50,000 gowns, 1 million 3D printed swabs, 100,000 face shields, and 100 gallons of hand sanitizer. The products were shared across the Banner system of 30 hospitals in 6 states. And Mike Lindsay with Thermal Strike Ranger. Mike's company, Thermal Strike, has a large bag for suitcases and other items to disinfect from bed bugs using thermal heat. At the start of the pandemic, when PPE access was severely low, the Thermal Strike Ranger bag was pivoted for surgical and N95 mask decontamination, receiving FDA emergency use authorization. And UCHealth, Dr. Gary Luckison, his clinical research team, and more than 1,000 vaccine trial participants have come together to play an important role in history and make significant contributions to innovation and research through the historic COVID-19 pandemic. Led by Dr. Luckeson, UCHealth's clinical research program in Northern Colorado has been closely evaluating the COVID-19 vaccine that was developed by Oxford University and pharmaceutical company AstraZeneca as an official trial site since late summer 2020. And the Healthcare Heroes honoree is Mike Lindsay with Thermal Strike. And Mike is here with me today. And Mike, congratulations.
Good morning, and thank you. Thermal Strike is probably one of the more unexpected stories here. As you mentioned, we were really designed for bed bug management, and based on a product I invented over 10 years ago. Although the original patents included the ability to kill pathogens, we didn't really have a need to step that up. But when there were only 700 cases in the US, we were already in place at a local, with the local healthcare community, and began disinfecting PPE. So I certainly didn't take the task on by myself. The critical component was the number of people that stepped up in healthcare, engineering, and the government to establish networks of support. So thank you.
Great. Thank you, Mike. Great innovation on your part and the part of Thermal Strike. And we thank you for your efforts. Our next category is Mental Health Care Provider of the Year. Very important sector for us, especially in this past year. You can see our nominees on your screen. And our three finalists are Janina Farinas with La Cocina. Dr. Farinas has spearheaded advocacy, vaccine access, and support to the Latinx community far above and beyond her scope of service as a mental health provider. La Cocina began in early 2017 to dismantle systems of oppression and co-create paths to liberation by providing full access to traditional and non-traditional forms of mental health and health equity support services. On average, their 20 employees serve about 140 families per week and complete 500 to 600 contacts with those clients weekly. And Adina Kling with Longmont United Hospital. Adina is a true supporter of each associate and patient for their whole-centered care. Adina is always available to talk with associates who may be struggling with a difficult patient case that they have dealt with during the day. She will stop and talk with patients and families that may also be struggling. And Alicia Mylar with Summit Stone Health Partners. Alicia has dedicated her career to helping marginalized people receive mental health and addiction treatment services to reach their greatest potential. At Summit Stone, Alicia focuses on providing behavioral health care to clients who are experiencing homelessness. At the start of the pandemic, when Summit Stone went almost entirely remote, she was the first to step up to provide uninterrupted in-person services. And the honoree is Alicia Mylar with Summit Stone. Alicia is with us, and congratulations for this award.
Thank you so much, BizWest, and to my agency for nominating me. I know how much every mental health care provider, including my fellow nominees, have given this year, and so it's truly an honor to be recognized in this way. The pandemic has been disproportionate in its impact, and one of the populations hit hardest was people experiencing homelessness and housing instability. I'm in awe of the strength and resilience of my clients and grateful that they allow me into their lives. I also wouldn't have made it through this year without the support of my coworkers at both Summit Stone and our partner agencies. In a year full of constant change, I've been privileged to work with people who are so incredibly compassionate and dedicated to protecting the health and safety of our houseless population, and I want them to know how truly thankful I am for them.
Great, thank you, Alicia, and again, congratulations. Our next category is Skilled Nursing and Assisted Living Facility of the Year. You can see our nominees on the screen. And our three finalists are Garden Square at Westlake Assisted Living. The entire staff has gone beyond keeping loved ones safe during the pandemic. Despite the risks, they continue with positivity, from setting up virtual iPad visits to celebrating virtually Mom's 80th birthday and keeping her and other residents COVID-free. Each staff member, from housekeeping, maintenance, residence assistant staff, dining, medical personnel, and administrative staff, worked tirelessly throughout the pandemic. And Tamara Gebhardt with New Mercer Commons Assisted Living Facility in Columbine Health Systems. Tamara has excelled throughout this past year during the pandemic. She has picked up shifts, has come in during her days off to help cope with COVID testing, and just overall stayed positive through a year of uncertainty. She has adjusted to the constant changes with COVID, the expectations, regulations, and has been an overall positive support system for the organization. And Good Samaritan Society, Fort Collins Village. From the first day that the skilled nursing assisted living community went on lockdown in March 2020, the Good Samaritan Society Fort Collins Village team went into overdrive. The staff had to refocus what it meant to work together to achieve that singular collective objective to keep our residents alive. After 13 months, not a single resident in the facility contracted COVID-19. Additionally, the staff embraced the vaccine as soon as it was available, with 95% of residents and 85% of staff fully vaccinated. And our healthcare heroes honoree is Good Samaritan Society, Fort Collins Village. And joining us today is Carrie McFarland, Administrator. Carrie, good morning and congratulations.
Thank you. This is such an honor, and especially with those that were nominated. We are just thrilled. I was actually the director of nurses when COVID started. I hadn't been here for very long. And just the teamwork and with all the difficulties and just, you know, I've said over and over during this time that our hardest job is keeping people alive. And, you know, for the team that came together here and just, you know, this is their home. These are, you know, the residents are our heroes because they're the ones that had to live through this. And so for us, our biggest thing is to keep encouraging people to get the vaccination, to keep people safe. And just, you know, this is just an amazing honor, and we cannot tell you thank you enough. I just am thrilled to be here today, and thank you.
Great. Thank you very much, Carrie, and congratulations to the entire team at Good Samaritan Society, Fort Collins Village. And our final category today is the Volunteer Award. And our nominees should be visible on the screen. Our three finalists are Fuerza Latina. Fuerza Latino's hotline workers for nearly a year have staffed the call lines of Spanish-speaking workers and families seeking rental assistance, providing COVID information, vaccine support, and more. They collectively committed hundreds of hours to support their community during a time when other systems did not. Emily Kemme with UCHealth. During the height of the pandemic in Weld County back in the spring of 2020, Emily was busy at work supporting Frontline heroes. She jumped into action and began coordinating a program that both supported local restaurants while feeding healthcare employees and their families. This program allowed community members to purchase meals from or make donations to local restaurants that in turn provided meals to healthcare workers, either by being delivered to the facilities or in the form of to-go vouchers for staff to pick up food. The program supported more than 30 restaurants and provided more than 2,000 meals to frontline staff and their families in Weld County. And Mark Meyer with Boulder Community Health. Boulder Community has screeners at its front entrance, staffed by a few volunteers and staff. When the call went out last year, Mark was the first person to offer to help as a screener. This involves screening each and every person who enters the hospital for COVID symptoms, taking temperatures, and being sure the correct mask was in use. And our Healthcare Heroes honoree is Mark Meyer with Boulder Community Health. And Mark, congratulations on this award.
Thank you very much. I want to thank BizWest for this opportunity and the award. And I'd like to thank all the staff and administrators at Foothills Hospital. I'd especially like to thank Kathy Burchett and Tom Brewer my leads at Foothills Hospital for the opportunity to volunteer as a screener, ensuring the safety and health for all the local, for the community and members of the community utilizing the facility and the staff at Foothills. Due to an illness in my family, I spent several weeks at Foothills in 2016. And the care provided eventually inspired me to volunteer and give back to Foothills as I was able to retire early. I'd also like to thank my 4 kids for putting up with supporting me and putting up with my unusual and spotty schedule with the screening position. And just once again, I want to thank BizWest for this honor. Thank you.
Thank you very much, Mark. And again, congratulations. And I want to thank all of our attendees for joining us today, and congratulations once again to all of our nominees, finalists, and honorees. I want to thank our sponsors, our supporting sponsor, Anthem Blue Cross Blue Shield, and thank you to Charles Ritz for jumping on board to help make this event possible. Our associate sponsor, H2 Manufacturing, our trophy sponsor, the Well Trust, and our selection committee. And I can't say enough about these individuals for the work they put in to sift through more than 100 nominations, each of the nominees was deserving of an award in truth. But to sift through all of those and to whittle it down to the 10 that we did was truly an amazing task. And I want to thank again, Dr. Joel Montbrion, George Hayes, Julie Johnson Hafner, Jean Hafner, Ron Seacrest, and Charlie Harms. I also want to thank our Healthcare Coalition, Columbine Health Systems, Boulder Community Health, Centura Health, Avista Adventist Hospital, Good Samaritan Society, and SCL Health, Good Samaritan Medical Center. We have a couple of upcoming events you should be aware of. Confluence, the Colorado Water Summit on July 22nd, and Northern Colorado Women of Distinction on August 26th. Thank you all very much again. Thank you to our healthcare heroes, and we will see you next time.